Okay, good morning. I'm having some technical issues with streaming into Facebook, so let me know if you can hear me okay. I also had audio issues the other day, so give a thumbs up if you can hear me okay and not weird robot sounds, which is what happened last time. And I just need to pull up my notes, so give me one quick minute and I'll wait just a moment for people to show up. Sorry for the late start. Like I said, a little bit of technical issues, but we'll get it rolling here. We're going to talk about learning styles today and using different learning styles in nursing school. So, the key with this is that yes, we all have kind of maybe one or two learning styles that we really gravitate toward. And there are different ways to use those learning styles in nursing school, but the trick with learning styles in nursing school is understanding that you will have to use all learning styles just because of the way that the information is presented, right? So I'm still waiting to get a thumbs up or a comment that says you guys can hear me before I dive in. So if you could do that real quick. Otherwise, I'm just going to assume you can hear me unless you otherwise say you can't. Okay, all right, great. So the reason that learning styles have to be so varied in nursing school is simply because data is coming at you in all different ways. And in the clinical setting, especially, you don't get to choose how information comes at you. So you can't just say, well, I'm only a visual learner and that's the only way I can get information in, because you're going to get all kinds of information in other ways. So speaking of visual learning, so in the clinical setting especially, you're going to get data from what you see with your patient, like your assessment, what you take in when you observe the patient. That's visual data. And there's a lot of that in nursing. You're going to get numerical data, which requires you to be able to read numbers and interpret them. That's going to be in the form of vital signs. That's going to be in the form of your lab values and things like that. And thank you for letting me know you can hear me. You're also going to get information in through your ears. So if you're not an auditory learner, you need to start ramping up your ability to notice with your ears, because you're going to get so much information from the monitors. For example, they make all kinds of sounds and they have all kinds of alarms and they all sound different and they alert you to different things. And then there's also the things that the patient says to you. There's things that you hear with your stethoscope. This is all data that's coming at you auditorily. And then, for those kinesthetic learners, the people that like the hands-on, you're getting all kinds of data with your hands when you touch the patient, when you work with equipment to see that it's functioning, or as you're setting it up. You're going to read a ton of information. So if you don't have a good solid ability to read information and take it in and assimilate it and understand what it means, that is something that you'll need to work on, because you're going to be reading the patient's H&P, their history and physical, reading your orders in the chart, reading your medication administration instructions, a lot of reading, and then using that information to do things in the correct way. So there's just a lot of data that you need to take in. It comes at you in all different ways. So what I say to this is, even though you may have a specific learning style that you really gravitate toward, in the clinical setting, you don't get to choose, right? So you really need to be aware of that, especially if you know you're weak in a certain area, ramping up those skills and noticing yourself using them in at the bedside when you're working with patients. And then different subjects in nursing school lend themselves to different learning styles. So for example, sitting in a lecture and listening to someone lecture to you is great for auditory learners. If they've got fantastic visuals to show, that's great for a visual learner. But if they don't, and they just show you the words that they're saying on their PowerPoint slide, so now you're using reading and auditory, but you're a visual learner, you're going to have a hard time with that lecture, right? And then skills lab, that's full on hands-on, right? And so let's talk a little bit about each of these key learning styles and how they can be maximized in learning in nursing school, and ways that you could maybe enhance your ability to learn in that way. Okay, so visual learners are going to really get information in best when there are images, when there are ideas and relationships between concepts. The ability for a visual learner to make those connections, kind of imagining them in their mind, is really, really strong. You're going to do great again with images. You're going to do great with charts and graphs and making concept maps and things like that. So a concept map might be for something like a disease condition or a patient plan of care where you're connecting different concepts together. And then charts and graphs are great for visual learners because you can take the information presented in that chart, in that graph, and understand data, which is really important. And then another key tip, if you are a visual learner, something that I really like to do is make a compare and contrast table. And I feel like this falls into the visual category because you can then kind of picture where the things fall in the table. So for example, let's say you have conditions that are similar but different. This happens a lot in nursing. So like Cushing's and Addison's, or hyperthyroid, hypothyroid, right? So same but different, right? Kind of like opposites of each other. You can make a table that shows the patho for each one. So you've got the patho for Cushing's here, the patho for Addison's here. You've got the signs and symptoms for Cushing's here, the signs and symptoms for Addison's here, the meds and treatments, the complications, etc. So that would be a way to kind of visually organize the information so that later when you're with a patient or you're taking an exam, it's a little bit easier for you to recall that information. And then obviously as you are working through your reading for nursing school, which I talked about a couple of days ago, really paying close attention to drawings, diagrams, illustrations, all of that in your textbooks. And then another key tip for a visual learner is to see what videos are available out there. Like for example, let's say you were in Skills Lab and you learned how to set up an IV, prime the tubing, set up the pump, all of that. But you didn't really get it, you need to practice some more, but you're not so much a kinesthetic learner, you're more a visual learner. Watch videos. Go to the manufacturer's website. I guarantee you they have a video showing you how to set up their IV pump, right? So you can watch videos of people doing things. You can watch videos with animations, videos with graphics that show the relationship between concepts, things like that. I hear Khan Academy is great for things like physiology, if you needed to go back and review physiology. And then a visual learner is going to do a lot better with maybe in-person classes versus maybe just learning online remotely where you're mostly just doing a lot of reading, right? And then in clinical, my advice is to pay really close attention to all the things that you're seeing, like really pay close attention. If you are strong in this way, take advantage of that. And if you're not strong in this way, pay attention to working on those skills. Pay attention to what you're seeing. How does the patient look? What does the nurse or the respiratory therapist or the doctor do when they come to the bedside to perform an intervention? How does the patient respond? All of this involves noticing and assessing, which are really important skills for nursing. Okay, so that's how visual learners can kind of pull on that skill to be successful in nursing school, and also how you can build up those visual learning skills. Because again, at the bedside, you don't get to choose how the information comes your way. Okay, and then auditory learners really do well with listening, obviously, listening to information. They also do well from talking out loud, like talk out loud. Talk through concepts, even if you're just talking to yourself. I would say if you're going to do this, record yourself talking through the concepts and then play it back so you can hear it on repeat. Like play it while you're out for a walk or driving in your car. So here's a little tip. It might sound a little bit risky, so I would not suggest doing this in a in-person class where you would not have access to the information. But let's say you have to do an online module. Maybe you have to watch a recorded lecture. Do an experiment where you don't take notes while you're listening and watching the lecture, but you just really focus in on listening if you're a heavy auditory learner. And then go back after the lecture and fill in your notes. Sometimes for some people, when they just can listen, they actually retain the information better than if they're trying to write and listen at the same time. Okay, so I would not say do that for the first time in a lecture where it's live and you'll never have access to the info again, but a recorded lecture where you could go back if it didn't work out that great would be a way to practice this. So another great tip for an auditory learner is if you have the option to listen to a lecture again, maybe there is a recorded version, listening to it more than once can be really, really helpful. Obviously, listening to the Straight A Nursing podcast can be really helpful for you. And if you're in a study group, then it would be really beneficial for you to discuss ideas, talk them out, teach it to another student. Do those kinds of things where you're talking and listening, talking and listening. You can make up stories. I did that a lot for pharmacology. I made up a song for bone ossification way back in anatomy and physiology that I probably could still mostly recite, which is kind of funny. You could read out loud to yourself as you're doing your reading for school. Reading out loud to yourself could be a way that takes more passive reading and turns it into an auditory exercise. And then in clinical, really clue into what you can hear. You can get a lot of data in clinical with your ears. I've worked in critical care environments for my whole nursing career. So there's monitors, attached to the patients. And even without looking at the monitor, I can tell by the tone or the pitch of some of the sounds that there's something going on with my patient. So for example, the SpO2 in our monitors, you can turn the sound on or off. We have ours on so that you can hear it's a higher pitched tone when the SpO2 is above like 93 or so. And then as the SpO2 drops, the tone decreases. It becomes deeper in pitch. And then it goes way down when the SpO2 gets into like the 70s or the 60s, which hopefully doesn't happen. So if I'm standing at the bedside, maybe I'm charting, maybe I'm really focused on the patient's Doppler pulses that I'm trying to find, then I don't even have to be looking at the monitor. I don't even have to be looking at the patient breathe. I can tell by listening, oh, Bob needs to take a deep breath. Bob needs to breathe because I'm listening with my ears. So pay attention to those types of sounds. Pay really close attention to the things that the patient is saying to you, the words that they say, the things that you hear with your stethoscope, for example. And then kinesthetic learners. So you're going to really thrive in your skills lab because it's totally hands-on. It's so much fun. Skills lab is such a blast. And in simulation, you probably have a really good time as well there because you get to do stuff. So if this is how you learn best, you're going to really shine in these types of environments. If you are not, or you just want to maximize this, then I would say the key here is to use your hands as much as you can. Get in there, touch things, do things as much as you can. If you have open lab time at your school where you can go in, maybe it's Tuesdays from 4 to 6 or whatever, open lab, you can go in and practice whatever you want. Absolutely take advantage of open lab. It is absolutely invaluable to get your hands on the equipment. Okay, so I would definitely recommend that. And let's say you're practicing a different, maybe not an equipment type skill, but like an assessment type skill. Get your hands on some people, get some volunteers, do a full head to toe, do a full neuro assessment, practice it on people as much as you can, do it over and over and over again. And then I saw a source as I was researching this topic that said for kinesthetic learners, sometimes just being physical as you are learning can really help. So it suggested standing while maybe you're watching an online module, right? You're watching an online lecture or something like that. Standing while you're doing that, tossing a ball, using a fidget toy. If it's something where you can take it with you, going for a walk, doing these kinds of physical things as you're learning can be helpful for kinesthetic learners, which I found to be really, really interesting. And then in clinical, again, what you're going to do to really maximize your hands-on learning is to just hop in there and do as much as you can. Get your hands on people, get your hands on equipment as much as possible, okay? And then the last one is reading and writing. There's a ton of this in nursing school. A few days back, I talked about how to approach the reading in nursing school so that you don't feel like you're behind if you're not reading every single word. I actually give you a bit of a smarter, more time efficient way to approach the reading, but there's a ton of it, right? So even if reading and writing is not how you learn best, I'm sorry, you're going to have to use it to some degree in nursing school because it is just so prevalent. And again, in the clinical setting, you don't get to choose. You're going to have to read charts. You're going to have to read information in that way. So if you haven't seen the video from a few days ago about reading, definitely go back and watch that. I would recommend as you're reading, one of the things, so let's say you're reading a section that's really lighting you up. You're going to read the whole section because your neurons are firing, you're engaged, you know this is relevant information. What I recommend is staying super engaged as you read. And one way to do that is I like to use highlighters, and you've all seen those pictures where people highlight every single word. You're not doing that, but you can use different colored highlighters for different types of information. So what I recommend is choose a color palette, pink, yellow, green, orange, blue, purple, whatever, and then assign a color to each key type of information. So for example, one color might be anytime a medication is mentioned, you color that in green, for example. Anytime the signs and symptoms are described, you color that purple. Anytime an intervention is listed, that's yellow, for example, so on and on and on. And that really helps you to kind of later recall that information because you can more easily see it. You know it's a med, you know it's going to be, green. You can more easily picture that in your mind. And then when you're going back and you're scanning your book for relevant information and you're like, oh, I need to find that med that's used in multiple sclerosis, and I'm looking on the page for something that's highlighted in green, right? So that's a really efficient way to use your highlighting and a way to stay engaged as you are reading. And overall, if you are heavily reading and writing learner, you'll probably do really well with self-directed study, online modules where maybe there's not a lot of direction from your instructor where they say, go and read these things and then do these quizzes and come to class, right? You'll excel in that. And then again, in clinical, you're reading the charts, you're reading the H&P, you're reading the medication administration record, the orders, all of those very fine details. You have to be very detail oriented. So what I would suggest is if you don't yet know what your preferred learning style is, you probably have a feel for it, right? But if you don't know, and it can change over time, then go online and find some learning style quiz. There's a million out there, and take one of those quizzes and see where you land. And if you land, like I kind of land, not completely across the board, but a mixture across the board for sure, then I feel like you're well versed to be more adaptable in nursing school because, again, the information's coming at you in so many different ways. Okay, so that's what I wanted to talk about today: learning styles, nursing school, how to maximize yours, and the fact that you will be using them all. So let me see if I can find the schedule for this because my computer was not working, so I had to turn it on at the last minute. So let me just see. Here it is. So today was learning styles, and then tomorrow is July 20th. Tomorrow we're going to talk about feedback and accepting feedback in a way that doesn't blow your confidence or make you feel like you're not doing enough, because you absolutely are. Okay, so I will see you back here for that, and hopefully all my tech issues will be worked out. Okay, I'll see you tomorrow, everybody. Bye.